Hi there, this is Jenny Guthrie, owner and nurse practitioner at Glow Medical Aesthetics, and we are talking about a procedure that is near and dear to my heart today, something I love to talk about, and that is Moxy by Sciton. What is Moxy by Sciton? It is a laser procedure that is non-ablative, and that basically means we're not causing big poke holes to the skin. The benefit of that is your downtime and recovery is so quick, because we're not causing poke holes or opening up your skin, which is our #1 protection against the environment. So when it's open, you gotta be even more careful with it. So this procedure is quick with fabulous results. So this procedure is fabulous for all skin types. It doesn't matter how dark or how pale you are a great candidate for this procedure, which is wonderful because it has such versatility and utility for all patient types. Another beauty of this procedure is we can do it in the summertime. A lot of procedures, it's like, we can't do these in the summertime, but Moxy is a sun-safe procedure with a few parameters. We can do this procedure all year long. It's also fabulous for people experiencing melasma. As you may know, heat-based procedures on patients with melasma are sometimes a no-no or can cause exacerbations of that disorder. But the beauty of it with Moxy is when prepped appropriately, we can do this procedure on melasma patients with outstanding results. And melasma is a very frustrating condition because it doesn't have a cure and it's a lifelong management. And I would encourage you, if you have melasma, to consider adding Moxy as part of your lifetime management of melasma. So another wonderful aspect of Moxy is it's great for younger patients who are just wanting to slow the aging process and take the best care of their skin as possible starting young. We call this prejuvenation, meaning we're going to get ahead of the aging process before it really gets the ball rolling down the hill, so to speak. This is great for not only sunspots, which sometimes happen later in life, but it's great for fine lines, texture, pore size. It can reduce the appearance of pores. It can even help with some very minor acne scarring. Deeper acne scarring would need a different procedure, but if your acne scars are relatively mild and you don't want to go through a deep procedure with a lot of pain and downtime, Moxy is a great procedure for you. I always like to tell my patients that it makes your skin look like a filter, like it's airbrushed or polished. Everyone wants glass skin these days. If that's something that you would aspire to have, I would definitely encourage you to use Moxy as part of your plan to get that. So Moxy is a fabulous procedure as well to stimulate collagen, which is something that we hear us talking about all the time around here because collagen is so important to the health and the appearance and the vitality of our skin. Collagen is like the foundation structure that kind of keeps everything, the glue that keeps everything supported and together. And as time marches on, our body breaks down collagen faster, and the collagen that it builds back is frankly kind of crappy, meaning it's not as tightly bound and it breaks down even faster. And so it's like a snowball going down a mountain. And as our collagen degradation is happening, the snowball is getting bigger, it's traveling faster and faster down the mountain. And so again, getting ahead of that and planning ahead, because if our body's just left to their own devices, the unfortunate reality is that collagen destruction is just going to happen organically whether you do anything or not. So you have to plan ahead, you have to be methodical, and you have to be proactive about the things that you're doing to kind of slow that process. And that does start some with what you put in your body as well as the treatments that you're receiving on it. And using the Moxy procedure in office is really important at protecting collagen in your skin. So when you come into the office, there's some things to think about. Of course, we would prefer your face be freshly washed and cleaned. If that's not possible, we're going to have you wash your face again anyway, because we really want to be clean and we want bacteria and makeup residue off your skin. You need to not have a spray tan for 2 weeks before, and this includes any products that you're using at home, like self-tanner serums or tanning drops. Those need to be discontinued at least 2 weeks before your procedure, because if those are on your skin, the laser can't see through them, and we run the risk of giving you a burn, which is not what we want to do at all. And it's our job to protect you and to give you the best, most fabulous result possible. And so no spray tans, please. Even if you've used it and you exfoliate that day, really want to be away from that for 2 weeks. You can be in the sun, but if you come in with a sunburn, we can't treat you with Moxy. It's okay to come in with a tan, but just not a sunburn. The other thing is, if we do treat you with Moxy, I don't want you going to the pool or the lake the next day. I would prefer that you wait a good 3 or 4 days before any of those kind of procedures, just to be safe. Because it is a sun-safe procedure, but we also want to be mindful of that sun exposure. However, my caveat to this, if you are a melasma patient or you have really dark skin and you're prone to what we call post-inflammatory hyperpigmentation, meaning if you get bug bites, you get a scratch or something on your skin and that stays there for weeks and weeks and weeks, then those people, we might need to be a little bit more mindful of sun exposure. So again, your provider can go over this with you at your consultation or when we're going over your post-procedure instructions. So just kind of plan ahead accordingly, because we don't want you to come in for your procedure and then tell us you're leaving for vacation the next day and we have to reschedule your procedure, because it's a bummer for us and a bummer for you, and none of us really want to be bummed out. Once your face has been cleansed, we are going to take some medical images of you to document your progress. We're also going to do a Visia skin analysis, which is an in-depth analysis that looks at your pores, your fine lines and wrinkles. It looks at your UV damage, your sunspots, your brown spots, all of those things, because we want to track your progress as best we can and show you your improvements that you'll be receiving from this procedure. We will be putting topical numbing on your face so you can be comfortable during your procedure. And we also have a chiller that we can use in certain individuals during your procedure as well if needed. Most patients don't need the chiller once we've numbed them really well. It's going to feel kind of like scratchy, warm sandpaper in certain areas. The procedure itself, depending on the areas we're treating, may take 15 to 20 minutes. It'll take longer than that, so plan ahead with your total time for your appointment, for checking in, for paperwork, for your medical imaging, for cleansing your face. Numbing takes about 15 minutes, so we have to calculate that into the time. The actual Moxy procedure itself is very quick, but I would still plan on being here in the office for about an hour to an hour and a half, so plan your day and your schedule accordingly, please and thank you. So part of this procedure, we are going to put you in a robe or a wrap. So don't be alarmed about this and plan ahead, but mainly we don't want to get numbing on your clothing, and certain kinds of clothing we want to keep away from the laser itself. You may decide that you want to add on your chest or the décolleté to your treatment, and having this on allows us to do that. Another thing about our Moxy procedures and all of our laser procedures here at Glow Medical is the prices include the treatment of your neck. And this is by design. There's a reason why we do this. It's because I've been doing this a very long time. I've worked in this industry since 2009. I have been around the block. I've had conversations with many women from early in their 20s all the way up into their 60s. And I have a lot of redundant conversations with people because we all share very similar concerns. Sometimes my little 20 and 30-year-olds are on a budget and they just don't want to spend the money for their neck. So they don't treat their neck and they only treat their face. I can completely understand and empathize with this. I remember those days as well. But then on the flip side, I have some of my 50-year-old and 60-year-old patients coming in, and what do they say to me? Jenny, I wish I would have treated my neck earlier. And so I'm trying to prevent my little 20 and 30-year-olds from having that conversation with me down the road or one of my other providers of, I wish I would have started treating my neck, because the neck skin is thinner than face skin. It also doesn't have all the same adnexal structures in it, meaning it doesn't have as many hair follicles in women. It doesn't have as many oil glands as we have in the face. And so the skin is less hydrated and less supported. So it responds to free radical damage, and it responds to pollution and UV damage faster than the skin on the face. In fact, the skin on our neck is more like the skin around our eyes, which is very delicate, and we have to start protecting it earlier. So all of our laser procedures include neck treatment for this very reason. When we understand the anatomy of the skin, when we understand the aging process, and I know what your priorities are going to be when you're hitting your 40s, your 50s, and your 60s, and I promise you it will include your neck. So step by step, what to expect with your Moxy procedure at Glow Medical Aesthetics. After you have your medical imaging done, once you've washed your face, you do your medical imaging, we'll do your Visia. Of course, we will have already reviewed your medical paperwork that you have. The next steps are we're going to take you back to the treatment room and have you change into the wrap that we talked about. Then either your provider or our medical assistant will make sure that your face is clean, apply the topical numbing, and you will get to lay calmly in the room, relaxing for about 15 minutes to let the numbing really start to work. During that time, your provider may come in and review your medical paperwork, your consent forms, ask any questions you have, and review your Fitzpatrick scale. We will talk about Fitzpatrick under frequently asked questions if you want to know what that is. Once the numbing is complete, we will remove the topical numbing and then we will start your procedure. So we have a chiller if you need it, which is just basically a device that blows really cold air on your face if you're experiencing any kind of discomfort during the procedure. Most patients won't necessarily need the chiller with the numbing cream because we use really fabulous numbing cream here at Glow Medical Aesthetics that works really well. It's going to feel a lot like warm, scratchy sandpaper. There are some areas that are a little bit more sensitive than others, but as we've talked about already, this is a really quick procedure. In fact, it can be done in 15 or 20 minutes, including the face and the neck, so it's really quick, so it's not prolonged. Once we're done with the procedure, we're going to apply a Velez mask to your face. This mask, it pulls the heat out of your skin and it actually drops the temperature of your skin about 10 degrees. You will be able to lay in the room for about 10 or 15 minutes with this mask on your face, and if you choose, and depending on your skin type, you may need to leave the office with this mask on. So prepare to scare your family and your friends. We'll send you home with a post-care kit, and we will give you detailed instructions on how to take care of your skin. You'll also be able to take your Velez mask home for use again later that evening and again the next morning, and then you will discard the Velez mask at that point. The post-care kit that we give you is going to last you a good 5 to 7 days, and we ask for the first 5 to 7 days that this is all that you use on your skin. You may have fabulous and wonderful skincare products and things that you've even purchased here from Glow, but we ask that you not use those unless specifically directed by your treatment provider to use them, and use only the post-care kit. You must be very faithful using sunscreen as well during this time frame, and you need to be using sunscreen at least 2 weeks before your procedure as well, so just plan accordingly for that. Your skin is going to feel rough, kind of, I say like lizard skin or sandpapery. It doesn't necessarily look different, but if you run your hand over it, it will feel rough. For the first day, you might be a little pink, like a mild sunburn. Depending on just your predisposition to swelling, some people may have a little bit of puffiness around their eyes. I'm a sweller, and so when I have this procedure done, I look like I had a good cry the next day when I wake up in the morning, and I use some cooling ice packs that help settle that down. You can also take a little bit of a non-sedating antihistamine that can help, as long as you can take those with any other medications or supplements that you are currently using. So that rough skin is going to last a good 5 or 6 days, and it's just going to slough off. It's not going to come off in sheets like you've had a big chemical peel, but it's just going to be kind of like little flakes, like little sawdust flakes that come off the skin. You can wear makeup. However, as ladies, you know, if your skin is rough or dry and you put makeup or powder on it, it just makes it look more rough and more dry. So depending on the areas we treat, you might be able, you could wear lip makeup and you could wear makeup on your eyes, but then maybe not wear base or powder. So again, you have to plan this around any big meetings that you have, any presentations, any photos that you're going to be doing. If you want to absolutely look your best, we recommend at least 2 weeks for this procedure for those kind of things. But you can live your life. You just won't be able to wear as much makeup as normal for those few days. If that's important to you, just plan accordingly. For me, it's a little bit of what I call an occupational hazard, and I just roll into work as I am, and everybody gets to enjoy my recovery as I'm enjoying it. So frequently asked questions that we get about Sciton MOXI. Number one is cost. How much does this procedure cost? We have multiple ways for you to enjoy the benefits of Moxy by Sciton. We have a membership package that allows you to receive 4 per year. We also offer bundle pricing with packages. We have signature packages that include filler and the Moxy procedure that you can enjoy. We also have just Moxy by itself, and when you receive a series of 3, you receive a price break on that because we recommend a series anyway. Most people are going to need at least 3 to treat most of their concerns and receive optimal results. Another question that we receive is, what areas can we treat with Moxy? Of course, face and neck are the most popular areas, but we can add on décolleté, or there are other off-label areas on the body that we can treat, such as arms, legs, and all of those areas. There is a limitation to the amount of lidocaine topical numbing that we can put on you at any one time. So if you are interested in receiving body treatment at the same time as face, you may need to discuss that with your provider so that we can make sure and give you the safest treatment and not have any issues with getting too much lidocaine from the topical numbing. So that will need to be discussed with your provider. Another question that we receive is, what is my Fitzpatrick level? So Dr. Fitzpatrick was a physician who came up with a scale of looking at a person's skin's ability to tan. Why is this important with laser? Well, your ability to tan sometimes determines the type of procedure or the wavelengths of procedure that we can safely and optimally use on your skin. So this is something that you will be asked to fill out at the time of your appointment, and your provider will review it with you. Things that we consider are your actual skin color, your eye color, ladies, your natural hair color when you were 18, not what color your hair is now, or if you are chemically treating it, it's going to be the color of your hair when you were 18. Things like, how well does your skin tan? Do you burn? How long do you hold a tan? Different things along that line are really important. Another aspect that's important is your ethnicity, meaning if you have any Hispanic heritage, Mediterranean, Middle Eastern, any olive undertones to your skin, Asian ancestry, different things like that are considerations that we need to be able to calibrate these treatments specifically for you so that we can give you the results that you're desiring without having any untoward effects. So the Fitzpatrick scale goes from 1 to 5. And for example, I am about a 1, maybe a 2. The interesting thing is sometimes my face is a 2 and my legs are a 1, maybe a 0. Because I'm so pale. But you can have different Fitzpatrick levels depending on the amount of sun damage that you have, and that's something that we'll have to take into consideration. Meaning if your face is, you've protected your face better than you've protected your chest, for example, which happens with a lot of ladies, your face may be a lower Fitzpatrick, and your chest, because it's darker, may be a little bit of a darker Fitzpatrick. We may have to adjust your settings accordingly. The beauty of the Moxy is we can do this on any Fitzpatrick. So from that standpoint, there's a lot of safety and protection here, depending on those things, especially for darker Fitzpatricks. So many of our darker Fitzpatrick patients may have heard or been told that they're not a good candidate for laser procedures because of how dark their skin is. And in the past and with certain devices, that is absolutely true. However, with Moxy, we can treat the darkest African-American skin all the way to the most pale skin. So that is the beauty of this procedure, is its versatility with all skin types. Again, certain skin types, the darker your skin is, if you're more prone to what we call post-inflammatory hyperpigmentation, or getting darker spots on your skin, say after an acne lesion, a bug bite, or a cut, or if you have melasma, there are some considerations that we'll have to take into account both before and after your procedure with regard to lifestyle, sun exposure, using a topical product before and after that makes your melanocytes, which are the cells that make pigment, to make them a little bit lazier, because sometimes in darker skinned individuals or patients with melasma, those melanocytes just get a little bit hyper responsive to sun, especially after a heat-based device has been used on the skin, and we want to sedate those melanocytes. We basically want to tell them just to calm down. And so there are some topical products that we will use in addition to our post-care kit in those patients. And again, we can discuss that with you at the time of your procedure or at the time of your consultation so that you can be prepared for that and know that we're doing the best by you so that you have the best results possible. Another question that we get asked is, can I do Moxy with other procedures while I'm at Glow? And the answer to that is absolutely, you sure can. We just have to plan ahead a little bit depending on which procedures you're receiving and the order that we're going to do them in. With our Moxy memberships, we also have a Botox membership as well, and those patients can come in and receive their Botox and their Moxy the same day. We would just do the Moxy first and then their Botox treatment after the Moxy laser procedure. The other thing that we can do is we can do it in combination with things like microneedling. We can do it in combination with our broadband light procedure, which is also another light-based Sciton procedure, because combination therapy is always best if you're wanting to maximize your results and maximize your time here at the office.